Heart attack, medically known as cardial infarction, is a critical and potential life-threatening event that occurs when the blood supply to the part of heart muscles is obstructed. This obstruction is often caused by a blood clot forming or the coronary artery obstruction, which are responsible for the supply of oxygen and nutrients to the heart. Understanding the cause and symptoms of heart attack is crucial for timely intervention and better outcomes. Causes of heart attack. There are a lot of major causes of heart attack. Number one is coronary artery disease. The most common cause of heart attack is coronary artery disease, where arteries supply blood to the heart. The supply of the blood to the heart becomes narrow. The accumulation of a cholesterol or any other obstruction. The narrowing restricts blood flow. This increases the risk of clots that triggers the heart attack. Number second is plaque rupture. Plaque rupture is atherosclerotic plaque which build up the arterial pressure on your heart. May rupture leading to the formation of blood clots. These clots can block the coronary artery, cutting off blood flow to the part of the heart and causing death. Number third is spasm of coronary arteries. In some cases, the coronary arteries may undergo spasm. Temporarily, narrowing or clotting of blood flow can cause the heart blood blockage. So this can cause also result in heart attack. So next one is risk factors. What are the risk factors? There are several risk factors contribute to the development of coronary artery diseases and increase the likelihood of heart attack. There is some risk factors. These are smoking, high blood pressure, high cholesterol, diabetes, obesity, and sedentary lifestyles.